In our office, we see a lot of shoulder pain, a lot of shoulder injuries. There's a ton of different causes and diagnoses. What I want to talk about now, which is one of the more common ones we see, is impingement syndrome. Typically, this is an overuse injury of the shoulder. It's not like a traumatic cause, but it's a very common issue we see in our practice with a lot of different types of folks. Sometimes it's sleeping on it, sometimes it's overhead activities, it's weightlifting. There's a lot of causes of this impingement syndrome, but really what's happening is one of the rotator cuff tendons is being impinged upon or pinched a little bit, and it causes a very distinct irritation into here on the front part of the shoulder. We see a tendency for a lateral arm pain. It kind of refers down this way. A lot of times we'll check and have the patient raise their arm by themselves in 180 degrees, and usually in between this window here, about 80 to 120 degrees, there's some pain, and then it goes away. That's a common sign of impingement. We'll also sometimes have them press into their own stomach, and if that causes the pain, that might be a particular muscle. There's a lot of these little tests we're doing to actually pinpoint what it is and what's causing it. So with impingement syndrome, a lot of times, as you raise the head over, you're going to get this real sharp pinching on the front with referred pain there. There are some things we want to do on the front of the shoulder, but a lot of times the dysfunction is coming from the back part of the shoulder complex. Everything from scapular or shoulder blade stability into the posterior rotator cuff. And so we'll do a lot of different treatments back here, muscle work. We'll do the chiropractic manipulation in the mid-back, because a lot of times your mid-back is restricted. You're not getting enough motion within the thoracic spine here. And so we would do adjustment there to get that to free up. And then we want to work on the muscles in the posterior part of the shoulder. And then we will get into a couple on the front part as well. Because typically what's happening as you round a little bit and then you raise up, it just starts to pinch right in there. So we want to do things to get a little bit better function, a little bit better posture. There's 3 levels of stability in the shoulder. One is the first line of defense is your scapula, the shoulder blade. The second is that rotator cuff, which is going to be responsible for dynamic movement. And then the third is going to be like your labrum and some of the ligaments into there. Well, if any of these are not functioning well, the shoulder is not going to stabilize during motion, and it's going to the head of that humerus is going to migrate up a little bit and pinch onto that rotator cuff. It doesn't mean it's torn. I mean, that can happen, but in this scenario where it's just purely impingement syndrome and we've ruled out tearing, that's just irritating, and now we have a low level inflammation. We got to do things to get rid of that inflammation and the pain, but we also have to do things to correct the dysfunction. And one of the things we'll do, aside from our treatments, is prescribe you some particular exercises that are really help with that. And so we see this a lot in our office. We evaluate the whole thing. We rule out any red flags. We know if we need to send you for an MRI or an orthopedic specialist based on our evaluations. If not, we can treat you on that same day we evaluate it and get you going to resolution with this condition. We see it a lot. We get great results with it, and it's something that you don't have to deal with long term. My last point on this, and I can't stress this enough, is if you let this go on for a long time, one of the things we hate to see is when something becomes a frozen shoulder or adhesive capsulitis, where all of a sudden now you can't move this arm full range of motion. You're kind of stuck in here and it's really painful. That takes a lot longer to get rid of, and we see that happening. So if you've been having this for a couple weeks now, it's not going away, make sure you get it evaluated and treated and rule out any significant injuries to the shoulder.